We start off with news about COVID-19. A survey of over 13,000 people showed about 71.5% of participants said they would likely take a COVID-19 vaccine when it arrives. 61.4% reported that they would accept their employer's recommendations to take the vaccine. Authorities in the United States say the vaccine could be available as early as December in that country. It could take later before it arrives in Africa. For more on what to expect when the vaccine arrives in Africa, we're joined by Dr. Gbonjubola Abiri, Consultant Psychiatrist in Lagos. You're welcome, Dr. Abiri. Yeah,
Good afternoon. Can you hear me?
Good afternoon. Thanks for joining us in News Central now. So what can you tell us about feelers on the ground about how the African public might react to the COVID-19 vaccine when it eventually arrives? Having in mind the backdrop of there's been a lot of conspiracy theories, anti-vaxxers, some religious sentiment, and all of that. Do you think Africans would be receptive to taking, or will be open to taking the COVID-19 vaccine when it's widely available on the continent?
Well, to be honest, it's likely to be a mix of many emotions and responses when the vaccine finally does land at our borders and at our doors. For a number of people, it's likely to be a form of an eureka moment, especially for persons who, due to the distress, the loss of life and livelihood in different proportions over the past few months due to the COVID-19 pandemic has caused. Many of those individuals who feel like, it's an eureka moment, will feel at ease and, of course, welcome the vaccine. They will take it so that life can at least return to a level of normalcy for them. On the other hand, however, we're likely to also have people who would receive the vaccine's news with a lot of skepticism and doubt, and probably out of fear and anxiety may not be willing to take the vaccine. But from reports, from things all around us, it's likely that people are more willing to take the vaccine than otherwise. But then again, it's better to have a balanced viewpoint and know that some people may be willing while some others may not be willing.
Would you be open to a suggestion that, because some international airlines, Qantas, for example, has said travelers that are flying with their airline would be required to take a vaccine?
As an individual, I will definitely be open to taking it. I've been stuck here for a really long time and I've wanted to travel. So I will be open to taking the vaccine. I'm hoping that, people can open up and take it, open up to what science has shown, and of course to remove this limitation that has come upon us throughout this year. So I will take it. I don't know if you will be willing to take it as well.
Okay. Now, the WHO data has showed that most COVID-19 related deaths in Africa are linked to diabetes or some underlying conditions, and everyday illnesses have taken a backseat to the coronavirus since the outbreak. How has mental health fared during this period?
Well, thank you very much for the question. And, interestingly, just as other non-communicable diseases such as hypertension, diabetes, other respiratory problems have taken a backseat, mental health has, of course, also suffered in large proportions. Interestingly, what we have found over time is that the number of cases have continued to increase. So number of new cases, number of recurrent cases of mental health conditions have increased. In fact, conditions such as domestic violence have also been on the rise. Unfortunately, however, what the pandemic has done is that it has taken the spotlight off all these other conditions and has put it on just the COVID-19 alone. And of course, what this has meant for persons with mental health disorders is that they are unable to access care. They can't get care when they go to the hospitals, especially because quite a number of them are also afraid to contract the virus if they did go to a hospital. So mental health conditions have also definitely taken a back seat as compared with all other conditions, and especially as compared with the COVID-19 pandemic as well.
Just before I let you go, Dr. Abiri, what can individuals do to de-escalate their mental health situation, not to, make things worse for themselves? What kind of exercises, what would you recommend individuals do?
All right, well, so I'll simply say it in what I would call the 4 L's. And the first thing I would say is We need to learn about the possible mental health conditions that can occur when there's an exposure to a crisis such as this. So we need to learn. The second thing is we need to look out for each other, look out for yourself, look out for other people. And of course, that includes having a high index of suspicion. It's also important to listen to other people, in a calm, compassionate, and non-judgmental manner. And of course, if you find that there's something wrong with, behavioral changes in cognition, emotions, or other forms of perception, by all means, please link people with sources of support. So sources of support can be therapy sessions, it can be with a professional, but by all means, help people find help in this difficult time.
Thank you very much, Dr. Abiri. Thanks for your time.